But a year later, we are still fighting the virus as it continues to mutate. Joining us now to talk a little bit about the latest developments in the fight against COVID is Carbon Health's Regional Medical Director, Dr. Bayo Curry-Winchell. Thank you so much for joining us, Dr. Winchell. I really appreciate your time here. I feel like this year has honestly flown by. I can't believe that it's already been a year since that first vaccine was administered. I want to ask, how do you feel about where we stand right now in terms of vaccination rates across the country and here at home more specifically?
Well, first, thank you for having me. It has been a year and it's, really overwhelming to think about how many different things that have happened, but we also have to think about all of the positives, such as having the opportunity to vaccinate in hopes of really decreasing the spread of the COVID-19. So overall, although it's been challenging and difficult, there is definitely positives in the fact that we have vaccines that can help us fight this pandemic.
Obviously, the new mask mandate that's going into effect here in California that starts tomorrow. A lot of people are wondering, are we going backwards? Why would we do this, re-implement mask mandates when we've done so well in terms of vaccination rates? Talk to me a little bit about your thoughts on this new mask mandate.
So we have to really remind ourselves that mask is another level of protection. And so when we have a high level of circulating disease of COVID-19, we know vaccinations as well as wearing a mask can be very beneficial in decreasing the spread. So although I know it's hard for people to feel like, why are we having to don these masks again? It's important to remember that although we've done well with the vaccination status, we're still not at a high level. And so by wearing that mask, it decreases your chance of having, number one, a breakthrough infection or actually becoming infected or actually transmitting it to your family.
And implementing something like this right now, especially after what we saw last year and just knowing that more people are going to be gathering, the timing and this, just month-long mandate, do you see it going past this month-long mandate?
It's really hard to know. We do have upcoming holidays, which, I, as a doctor and a mom, I am excited to share and enjoy my time with my family. But it's also important to find ways to do it safely. And so if you're in a gathering and you are unsure of others' vaccination status, it's really important to utilize whatever resources you can to protect yourself. So, it's hard to know how long this mask mandate will be in place. But we do know that it's helpful and we are responding to the increase in cases. So that's the important thing to consider.
There is news, we just spoke about it a little bit, the COVID pill that Pfizer has been working on. What do you know about that pill? And is that something that both vaccinated people and unvaccinated people could eventually use?
Yes, so this is a wonderful additional resource in really fighting COVID-19. So if you, happen to come into either exposure or actually getting ill from COVID-19, this is a possible tool in fighting the disease. So we now know that if you have had symptoms within 3 to 5 days, it can reduce your chance of severe disease or hospitalization approximately 88 to 89%. So this is an additional, resource that we can help use to fight the pandemic.
And this is not something that's been approved just yet, of course. They're just kind of putting out their latest bits of information and data from their studies. How long before this is something that is available to folks?
So, scientists are doing what they do best, really taking note and time to make sure that this is going to be a drug that can be safe, amongst the different communities. And so, although I don't know the timeline, I anticipate that we will get approval, hopefully, in a couple of weeks to months. But again, it's important that we have those checks and balances so we can deliver the best option or best treatment for patients.
And I know, like we were talking a little bit, again, next week is Christmas. We've got New Year's coming up. So when it comes to gathering with folks, obviously this pill isn't something we have just yet. The one thing we do have is the vaccine and our masks. So that's kind of what you're suggesting people do in the meantime to keep themselves safe.
Absolutely. Utilize, vaccinations. That's a definite way to help protect yourself in hopes that you don't get infected. And masks are an additional source. So, really using what we have now because the goal is not to get infected. Yes, this medication is helpful if you get it, but we hope as physicians and healthcare providers, we don't want you to get COVID-19. And so, you can do that or at least decrease your risk through vaccinations.
Dr. B.C. Winchell with Carbon Health, thank you so much for joining us.
Thank you for having me.